Member from Kitchener-Waterloo.
Thank you, Speaker. My question is to the Premier. Is the government planning to privatize eHealth and Ontario's digital health assets?
Mr. Speaker, there is no possibility of the sale or the commercial use of people's health information. We've been very, very clear about that. The minister has said that. We're looking to improve the health care and service that patients receive as part of a digital strategy moving forward, Mr. Speaker. The Minister of Health wrote to Ed Clark seeking expert advice to assess the value of Ontario's digital health system, Mr. Speaker, and program its assets and all the related intellectual property, Mr. Speaker, and the infrastructure in which we have invested over years. The eHealth mandate, and I don't know if the member opposite knows, but the mandate of eHealth Ontario expires at the end of 2017. So we believe that we've been presented with an opportunity to determine the result of the investments that have been made, Mr. Speaker, and to determine if there are changes that need to be made and what the value of those investments has produced, Mr. Speaker.
Thank you. Supplementary.
Thank you. And yet, the Minister of Health wrote to Ed Clark last week asking him to look at eHealth specifically because of his experience in valuing public and private assets. Let's be honest, his experience in valuing public assets means selling public assets. After all, in 2014, when the Premier asked Mr. Clark to maximize the value of government business enterprises, we know that that was a public relations-friendly way of saying sell off Hydro One. Is this Premier looking for a way to hide a Liberal plan to privatize digital health assets?
Thank you.
No, Mr. Speaker. And I will say that Canada Health Infoway has estimated roughly $1 billion in annual benefits to Ontario as a result of the investments that have been made in eHealth Ontario, and almost $6 billion in cumulative benefits since 2007. So, Mr. Speaker, it's true that the Minister of Health has asked Ed Clark, because of his experience, to do an assessment of the results of those investments, Mr. Speaker. I think it's responsible, as eHealth reaches the end of its mandate in 2017, that we understand the value of those investments, Mr. Speaker, and we look at whether there is a way to understand the value of those digital assets and move towards a new vision for digital health in Ontario. Mr. Speaker, the member opposite lives in the Waterloo region. She knows how fast technology changes. She knows how important it is that we keep up and make the best decisions on this digital strategy. That's what this assessment is about, Mr. Speaker.
Final supplementary.
Thank you. The people in Waterloo Region also know how high their energy costs are, for sure, Mr. Premier. On October 21st, 2015, the Premier stood right there in her place, and she said, "We're not selling off the assets." Less than a month later, Ed Clark said it was a bold step. It showed political courage to sell Hydro One. This is why people have a hard time believing that this Premier isn't planning to spring another false surprise on the people of Ontario. Should Ontarians be getting ready for another Liberal sell-off?
No, Mr. Speaker. As I said, the Minister of Health has asked Ed Clark to do an assessment of eHealth Ontario in much the way I will use the example of the LCBO, Mr. Speaker. Ed Clark did an assessment of the LCBO. There are changes that are being made to the liquor laws in this province, Mr. Speaker. There are changes that have come about as a result of the work that Ed Clark did, Mr. Speaker. But there is no sell-off of that asset. So, Mr. Speaker, we're going to look at eHealth. We're going to look at the work that's been done and look at the investments that have been made and what the results are, Mr. Speaker, and understand how we move forward to make sure that people in this province have the best digital health strategy possible, Mr. Speaker. They deserve that. We need to keep up, and we need to make sure that we leverage all of the technology that is available to people in the 21st century and make sure it works for the people of the province and their health care.